have an opportunity now to take questions to our panel this morning. Again, we've got mics coming around the audience. So can I ask for any questions, please? Lady in the front here. And we'll just take one question. Again, if you could say your name and who you're from, and if it's directed to all of the panel or one of our speakers in particular, that would be helpful.
Okay, my name's Lindsay Christian. I work in the planning policy section at Newport Council. Newport Council, I thought it said Cardiff then. It's to Stuart mainly, but if anybody else has views, that'd be great. You'll probably find that most authorities haven't done an individual health impact assessment, but that's because we've covered that within the sustainability appraisal, including the strategic environmental assessment. And I was just wondering if there's any reason that this needs to be a separate process, if there's any advantages to doing the health impact assessment separately, or do you think it's repeating something that's already done?
Thanks, Lindsay. There's definitely advantages of doing it separately because you're basically focusing on health as a single issue, because it tends to get subsumed in the sustainability appraisal by other issues. So it was definitely worthwhile doing, and the inspectors found it useful at the examination as well. So it's that extra background evidence for your plan. So and it also came up with individual, quite specific recommendations relating to health, which tend to get lost within overall sustainability appraisal because it covers a lot of multitude of issues, doesn't it? Sustainability appraisal. So it did add value. Yeah.
Do any of the panel want to give a perspective on that question? Anything to add? I'm seeing blank faces, so I'll take that as a no. I think there was a question towards the back there. I saw a hand go up.
Hello, my name's Ewan Williams. I work for the Older People's Commissioner for Wales. The Commissioner chairs the Aging Well Wales programme. We've got a few partners here today, which is all about improving the health and well-being of people 50 plus in Wales. A large part of that is establishing age-friendly communities in Wales, and all local authorities have signed up to something called the Dublin Declaration. But we all know that it's a challenging economic climate. How best to get there in this current age of austerity, particularly moving from that vicious cycle, where people have confidence issues, lack of facilities, infrastructure. How do we get from that vicious cycle to that virtuous cycle? And as an additional question, if I may, in the context of the Wellbeing of Future Generations Act, what's the role of the public services boards in all of this? Thank you, Joe.
Okay. Right, two quite big questions there, thank you. And slipped a second quite big one in. I'm going to turn to Tim first, if you'd like to talk to the first part of that.
Yeah.
Yes, do you want to come back? We got that. Thank you.
Okay, sorry I didn't catch your name, but Older People's Commission for Wales. I think what I would say really is trying to expose the stories of people who do use bicycles, use walking for short journeys in Wales. I mean, their stories are untold, really. They're hidden. You'll often hear the voices of the lobbies that we've heard earlier in Ireland, but you don't hear the voices of the people who just kind of get on with life and they don't badge it as healthy, don't badge it as sustainable. It's just an everyday form of mobility. So the first thing I would say is exposing those stories, which is what we've tried to do with the Cycle Boom research. And I urge you to go and look at some of the videos from that, of the participants speaking for themselves. I guess secondly, it's a huge challenge. It's catch-22. You don't really want to kind of create a massive surge into substandard infrastructure. So I think that it's a kind of dual thing, really, isn't it? We're saying that from our research, absolutely cycling shown to have positive well-being elements as well as physical activity and PA. Yes, there's a massive role for e-bikes that the UK needs to take on board and think about, which is propelling ahead in Europe. However, that's not to deny the critique underlying all of that as well, that the actual stage where that's to be performed is absolutely substandard. It's it's suboptimal, and that needs to dramatically change. So, I think that's the kind of main message. And it is a catch-22 situation. You've got to kind of work on both fronts, really, of not kind of burying your head in the sand and saying cycling is the panacea, that we should all get on with it. It's kind of saying, it's got a very positive role to play. However, the conditions must meet X, Y, Z to be able to do that, and acknowledging that, really. I don't think There's absolutely no point in just kind of burying your head in the sand. And previous research that I've done on understanding walking and cycling with Lancaster University, 2008, 2011, we did that. We did deep ethnographic study in 4 other cities of the UK, and we exposed the kind of downright, absolutely appalling conditions in, the 5th developed nation, are we, in Europe, for walking and cycling. And that didn't go down well, I have to admit, with NGOs and people who are kind of espousing cycling and walking. But frankly, that's grounded research, that's the truth, and it did make policymakers sit up and say, we've got to do something about it. So I say not burying head in the sand, but obviously being proactive in that mission to create change.
Thank you, Tim. I'll go down the line there if Barry and Michael.
Yeah, just in terms of the balance between, being in a period of austerity where not a lot of funding is there for infrastructure, a part of achieving a balanced suite of measures that include infrastructural measures but also include car restrictive measures. Car restrictive measures don't necessarily have to be that expensive. Now again, like we've heard, they're not politically very feasible or acceptable, but they don't necessarily have to be very, very expensive to implement. There just needs to be a political willpower there to implement them. It's also a vicious circle in terms of safety and perceptions of safety around cycling. Often there's many misperceptions about how unsafe cycling is when it may not necessarily be as unsafe as we think, particularly outside the major cities. And the apparent, I suppose, safety concerns people have about cycling stops many people from cycling, stops kids from cycling, but also we can see if we have more people cycling, it becomes more safer as well. So when we get into discussions around the safety of cycling, then we always say, well, we need segregated cycling lanes, and that will indeed help more women to cycle, more children to cycle, but they're incredibly prohibitive and very expensive. So I think we also need to be thinking about how can we introduce some measures that are not going to be as expensive as segregated cycle lanes. And I mean, that's probably where we need to aim for, but we can't wait until the funding is there to do that.
Thank you. Michael? Okay. In that case, can I turn to Liz and Stuart, and if there's anything that you want to add to the older people's question, but can I also ask you to address the wellbeing of future generations question and the role of the public sector boards as well?
I think in terms of the role of the public service boards, then you've got a number of levers, and you can actually use quite a wide range of tools. For example, you can use health impact assessment to flag up these issues, and that they may expose actually what needs to be done. And also the public service boards have a duty to prepare wellbeing plans, and they're based on wellbeing needs assessments. So again, if you've got the evidence, but you can overlay it and provide those levers and that rationale for creating more age-friendly environments. We have an ageing up population, we know that. So it needs addressing, and it probably needs addressing sooner rather than later. And they do have a duty to look not just in the short term, but at the longer term too. So I think, if you get in, like Michael said, early enough, then you should be able to try and at least raise that awareness. And it's the more that you plug away and that you can provide the evidence for it, then I think you've got a better chance.
Yeah, the role of planning really in this is to provide the framework really, to provide a framework for sort of safe cycle and walking routes, and that's something we're looking to do for the LDP. We're basically identifying, within the master plans, areas for walking and cycling, interconnected spaces, and promoting community safety, making sure the cycle routes are safe as well and easy to use as well. So planning provides a framework really to take that issue forward.
Okay, thank you. Next question. Any? I think we've got one. Oh, sorry. We'll go over there, and then I'll come to you next. Thank you.
Hello, my name's Sunita Welch, work for the Brecon Beacons. Again, big rural area. My question really is probably for Tim and Barry. Obviously, all the work you've done has been in much more urban or sort of semi-urban environments. How do you think your research could impact on rural locations?
Yeah, absolutely. Thanks for stating that. Absolute urban bias, but we did actually get participants on the peri-urban areas of Oxford. So the kind of satellite villages and towns, like Abingdon being a classic one, some 6 miles bend, 7 miles south of Oxford. Many people commute along that corridor, the Thames Valley corridor, and then satellite villages around at Bristol Northern Fringe as well. So we did take kind of the suburban, general, kind of average, kind of British experience, ditto in Cardiff as well. Yeah, an interesting one. I mean, I think here, my title one was electrifying well-being. Electric bikes, absolutely pivotal in that, instrumental in linking people up over distances that perhaps they wouldn't entertain the idea of cycling from peri-urban areas to the centre of town or cities. So we've got lots of examples and cases of that, of people attempting that with others and wrecking it first of all, and then building up the confidence to make those kind of 6, 7, 10-mile journeys from peri-urban suburban areas. So absolutely. In terms of deep rural areas, I mean, Brecon Beacons, I guess that is deep rural. Our focus wasn't on that. I mean, that's absolutely something we'd be interested in looking further, rural travel and rural communities. But again, I think potentially e-bikes could be, absolutely a crucial link there, but with other public transport means as well. So, I did state that in the presentation, in the recommendations, that a lot of our participants, they weren't just kind of avid sole cyclists who were converted and then did everything by bike. These were people that were multimodal. They used the car, acknowledged that as a practical means of travelling in their everyday lives. Some of them used buses and public transport. And the e-bike or the pedal cycle that used in the 8-week trial was a kind of a tool for active ageing, and in some cases, an additional tool for local travel. But to kind of, as I said earlier, to make that a key tool in that kind of toolbox of mobility, that fundamental change in physical infrastructure needs to take place, which is, I think, where we disagree.
Thank you. Barry?
Yeah, just to qualify about the infrastructure, at the minute there's been loads of funding cuts announced across Ireland in terms of infrastructure, and I do absolutely recognise that infrastructure is incredibly important. I suppose that the point I'm trying to make is that if we rely on infrastructure alone, we're probably never going to get the behaviour change that we're looking for. Infrastructure is incredibly necessary. In terms of rural, I suppose one of the towns that we would have looked at, Dungarvan, which got that amount of money, and we didn't see the behaviour change. It had a population of about 10,000, but it was quite sparsely populated, so a lot of the community were spread out into the hinterland, and a big part of that project going forward was to include the rural transport link in that project, and they were asking us, well, how can we be advocates for smarter travel? And they tried to set up drop-off locations around the hinterland of the villages where people would be able to be dropped off and still have a short walk into the local villages. But when you're dealing with rural communities, car restrictive measures are not really that relevant. So it's about really trying to incentivize the route, and I suppose similar to what Tim is talking about, is to be able to actually show the benefits and well-being associated with cycling. And they've had some success in terms of getting buy-in from the business community, where if you can get local champions to be able to bring people along with them. So one example, in one of the villages, they would have a local bike shop which is now using a cargo bike to travel around and bring their paints. They have a paint shop to bring their paints around to the local businesses and people they work with around the small town. And getting local champions has been, I suppose, effective there to a certain extent. But definitely the rural transport link and linking them in. And they also try and integrate active travel into the local food festivals and small little community events that are going along. So yeah, car restrictive measures, I suppose, are less effective in those smaller communities.
Do you want to add anything there?
I mean, just going back to age-friendly environments, I think the TCPA takes quite a holistic view about some of these things. I mean, obviously the planning system is there to meet the needs of everyone, not just a particular group of people. But I think the whole point is that you need to have an adaptable environment so that over the longer period, or definitely the plan period of 15, 20 years, that it can adapt to people's needs and over time. But the rural issue is really important because we do come across this all the time. and partly it's our fault. We use the word healthy city planning, healthy urban planning, and we don't recognize particularly, the rural side. But I think, again, the infrastructure issue is really important because obviously having infrastructure doesn't mean that you will have the behavioral change. You can see all across the world. In China, they probably have segregated cycle lanes everywhere, but people don't use them in rural areas and urban areas. So I guess it's about behavioral change. And the way the planning system works is really to try and meet the needs of everyone, not just those in the urban areas. And I think as practitioners, we need to be very, very aware that we are in a country of different geographies, and that as town planners, we need to have policies that recognize these spatial differences.
Thank you. I think we've got time for just one more question now. So I think I just saw one more hand here. So I'll go to Malcolm next, if I could.
Thank you. Malcolm Moore from Public Health Wales. It was interesting, there was a report on this morning's news that, probably unsurprisingly for most of us, highlights the fact that the UK is now has the most congested roads in Europe. And we're constantly being reminded of how good our continental cousins are at supporting active travel, and yet we continue to struggle. And I think you made that point earlier, Tim. Apart from the fact that Holland is flat, what else is it that they're doing right that we need to learn from?
Yeah, thanks for flagging another interesting news report today. I was reading another news report on the train this morning in The Guardian about Copenhagen finally reaching the tipping point where there's more bikes in the city now than cars. It's reached that tipping point that Amsterdam reached in '95, I believe. So, I mean, the answer to your question is absolutely it's flat. Arguably, there's a Calvinistic underlying culture of simplicity and the bike fitting with that ideal of the nation. But, I mean, fundamentally, it's about infrastructure. I'm sorry, but it is about compact cities. It's about designing the city around the bike and feet rather than the car. And it's ultimately about political will and having those political battles over a series of decades that have laid the foundations for the culture to understand and embrace that. Yeah. And, that is a tough call in British society to kind of have that dialogue. And I guess over the years I've taught in planning and had different interactions with students and various people, it always comes down to that. It comes down to, well, in my backyard, the political will's just not there, or the politicians won't go near issues around car restraint. It's politics.
Yeah. Barry and Michael?
I'd say just very briefly to add that, I'd echo everything that Tim was saying there. I suppose the one thing we're trying to do in Britain and Ireland is we're trying to address this retrospectively, where in Central Europe, a lot of these cities, they decided and took a decision, quite by chance maybe, that they weren't going to design a city oriented around a car. And I think that's what we're doing. We're playing catch-up. And of course, it's more expensive to play catch-up.
A very quick point on density. I think your point comes down to development density. So once you get a density that's high enough to support infrastructure, that's when people start to recognize that, we'll start walking rather than taking the private vehicle. And we had a discussion on Monday at a different event about what is the density level that we should be promoting, recommending to town planners. And there is no easy answer. In England, we used to have 40 dwellings per hectare. We don't have that anymore. Whether that's appropriate for Wales, your cities or towns, I don't know. But I think the idea is that you find your density levels that's appropriate to support cycling or walking infrastructure, and then take it from there.
Thank you. Liz?
I'd echo quite a few things that the guys have said, but I was actually in the Netherlands about a month ago, and my colleague from the Institute of Public Health told me that actually they made a concerted effort many decades ago to promote active travel and cycling, because we make assumptions that actually the Dutch have always done it, but they haven't, and not to the extent that they do now. And it's still a priority in planning, again, mainly in cities. And I was really surprised to see that they actually are creating, within Utrecht, for example, there's this huge regeneration plan. But part of that is not just the cycle paths, and everything that goes with that, but actually cycle car parks, special tunnels that are primarily for cyclists, and it is very much the pedestrians beware. You know, it's much more of a priority. But they've built on that effort that they made decades ago, so that it is now natural part of Dutch life, and it's been fostered down through generations.
Thank you. Stuart?
Yeah, thanks. Yeah, car use is a big issue in terms of the LDP, because we're looking forward to 2026 in terms of development. Basically, we did a model of the city, and that found that if we continued with present car use rates, that the city would ground to a halt with the development we're proposing, the 41,000 houses I mentioned. So basically, the council's aim now, in terms of going forward, is to have a 50-50 modal split. So 50% of journeys will be by sustainable modes, either by bus, walking or cycling, and 50% by car, and that's the council's aim, and that's embedded in the LDP. So that's what we're aiming to have by 2026. So that's a key driver in going forward. That's driving the master plan of the strategic sites in terms of this rapid transit, the bus networks, the walking and cycling. So we're looking to change that. And I think going forward, transport, looking at changing that again to 60-40 going forward further. So that's the ambition of the city. So we're driving that agenda.
Great, thank you very much, everyone. And it's interesting to note, actually, after Liz's comments, that we have a delegation from the Dutch Public Health Organisation over here in Cardiff today, doing a reciprocal visit with Public Health Wales, and I know these issues will be on the agenda today. So thank you very much to all of our speakers for this morning, and again to the Minister in her absence. We're going to break for lunch now. I recognise we're a little